looking to create a chiseled jaw, improve the alignment of your teeth, or the shape of your jaw and face, or improve your head posture, then if you search for this, you may just come across mewing. I'm Dr. Rachel. I'm a holistic dentist with over 30 years in practice, and I've been doing research into mewing for you to see if it's all those things the social media influencers make it out to be. So I'm going to share what I've found, and I'm going to go through whether if mewing works or not, how it's done, and whether it is harmful or not. Now, mewing is a type of jaw exercise that promises to deliver all these things. Mewing is one of the latest crazes to hit the internet, but it's actually been around for quite a while. It was developed by an orthodontist in the UK called Dr. John Mew, which is who it's named after. Now, there's a lot of controversy over this technique, whether it does what it says it can and whether it actually causes harm. Mewing is a technique where you rest your tongue up against the roof of your mouth, and that is supposedly going to help change your jawline and your facial structure. So you push your tongue up against your palate and you keep it there all during the day, except when you're talking, and you even hold it up there when you're swallowing. And they're saying that that tongue pressure will alter the shape of your jaws and face. Well, imagine that your skull and your jaws and your face and your posture is a little bit like a house. Over time, bad habits can cause the beams, the muscles, to slump, and the roof, which is the jaw, to become misaligned. Now, mewing exercises would be like strengthening the beams and gently lifting the roof back into its proper position to create a stronger and more defined structure. Think of it as lightly tensing the muscles in your cheeks and jaws through the day. This subtle engagement, similar to how you might kind of work with a light weight in your hand, is said that it can strengthen and potentially define the areas of your cheeks and your jawline and actually the jaw shape itself. So here's a little breakdown of the theory. Proponents believe that constant tongue pressure on the roof of your mouth, including at the back of the mouth, that will influence jaw growth. It's supposedly going to widen the jaw and improve jawline definition and your posture, because now your jaws are wider, your airway's improved, and you don't have to have your head forward to be able to breathe more easily. There's muscle engagement, so mewing might provide a slight isometric exercise for the jaw muscles, and over time, this could lead to some strengthening and possibly a more sculpted appearance of this muscle down the side here called the masseter. However, there's a bit of a catch. There's limited scientific evidence. Scientific research on mewing's effectiveness is grossly lacking, and while some studies show that childhood tongue posture and position can affect jaw development, there's no proof that mewing works in adults and is actually counter to the science. And this is why I'm going to explain now why those claims around mewing being able to alter an adult's facial shape is a bit of a stretch. Well, number one is jaw development. After puberty, the facial bones are mostly set, particularly the ones in the roof of your mouth. Now, your roof of your mouth has two bones that sit together like that. That is called a suture, where my fingers are. And until you're about 8 or 9 years old, this suture is open. And that means it can move, so it can slide apart. And if you create pressure, if you put forces on there, as we do with braces and expansion devices, you can push those two halves of the jaw apart and you can expand it and get some growth. However, once that is fused, it doesn't matter how much we push, you can't open and stretch that suture without surgical intervention. I don't think that, because those bones are set, that pushing your tongue against it is going to exert enough force to make any significant changes, and therefore I don't think mewing's going to change the shape of your jaw very much, if at all. Genetics. Your facial structure is actually heavily influenced by your genes, as is your height and your build, your hair and your eye colour. Mewing just might not overcome your genetic predisposition. However, here's a caveat. If you do myofunctional exercises, which mewing would be a type of one, as a child, then we can get some influence on jaw growth and jaw shape, but not once growth has happened. So what are the alternatives? Orthodontics. If you've got concerns about your jaw or teeth, then consult a dentist or orthodontics for a safer and more proven and guaranteeable result. Then there are facial exercises. I've touched upon them, called myofunctional. Now, while evidence is limited, some targeted facial exercises might offer some sculpting benefits. However, I would consult a professional for some guidance before you undertake that. Remember, mewing is a trend with very little scientific backing, and it's best to approach it with some caution and consult a healthcare professional before you even look at attempting it. Now, mewing itself isn't inherently harmful, but there are some potential risks associated with improper technique or unrealistic expectations. So let's have a look at the downsides of mewing. You could end up with misaligned teeth. Now, if you're using mewing with excessive force or incorrect tongue posture and you're actually putting pressure onto your teeth, you can cause them to move, you can cause them to shift and splay out, you could even make them become loose. TMJ pain. Now, your TMJ, this is the temporomandibular joint, and it's the joint here just in front of your ear, and it's the hinge that allows your jaw to open and close and wiggle and waggle from side to side. It connects your jaw to the skull. Now, improper mewing and over-exercising this area can actually strain the muscles and the joint and lead to pain and dysfunction. You could end up with speech difficulties. That altered tongue placement can affect how you speak, and it can cause slurring or pronunciation problems where you lisp or you just can't get your words out properly. And look, wasted time. You've got to be pressing that tongue up there for a long time every day. You've got to be doing that day after day after day after day after day after day. Do you get my point? To get any significant changes. And there is no strong evidence. Sorry, I've got to do my jaw and tongue exercises. There is no strong scientific evidence that mewing actually changes your jawline or your facial structure. So you might spend a whole lot of time on this technique with minimal results. Time that you maybe could have just gone and got some braces and had it all sorted. So it's important to consider that mewing is not a replacement for proven treatments. If you've got concern about your jawline or your teeth or your breathing, because there's some, proponents out there saying that mewing can help stop you snoring, it can cure sleep apnea. Again, no science in this. Consult your dentist or your orthodontist and let's have a look at what your proper options are. In essence, mewing is being portrayed as a magic solution online. Now, I don't think that that's the case. Now, if you're curious about it, then as I said, speak to your dentist, have a look at the proper technique and avoid some potential risk. Speak with a myofunctional therapist, an occupational therapist. They might be better positioned to help you with your specific concerns. Now, if you're interested in improving your teeth alignment and your facial definition, then check out this video here.